Welcome to the second George Washington University Interprofessional Educational event. During the first event, we focused on understanding your own professional identity while gaining an understanding of other professionals' roles on the healthcare team. During the second event, we'll focus on recognizing how effective professional communication contributes to the success of an interprofessional team. Students from several different schools will be participating. You'll begin the day with colleagues from your own discipline. You'll work together to develop interview questions for obtaining a history from a standardized patient with multiple sclerosis. After the interview, faculty mentors will facilitate the use of the SBAR tool, which is discussed in detail later in this video. The SBAR tool is used to summarize your discipline-specific findings about the case. Then you'll spend time with colleagues from different disciplines. You'll represent your discipline and present your findings about the patient using the SBAR tool. Once each discipline's SBAR has been shared with the group will then develop a plan of care for the patient. Remember, the focus of this experience is on the importance of effective team communication. Don't worry if you don't have all the answers. Instead, focus on how verbal and written information can come together to create a better representation of the whole patient. The last part of the event will be a panel discussion with persons living with multiple sclerosis. We look forward to seeing you at the second Interprofessional Education event. Please come ready to be engaged and to learn from your colleagues in other disciplines.
Many of us are aware of the story of these 6 blind people who are all exploring an elephant from its different perspectives. The story ends with these 6 people coming together and realizing that they were all exploring the same thing, but calling it different things based on their perspective. Unfortunately, there seems to be a common thread in our healthcare system today. To address this problem in our current healthcare system, several organizations at the national level have come together to try to problem-solve ways to improve patient safety, reduce medical errors, and improve the overall competence of care. Specifically, the Institute for Healthcare Improvement has identified the triple aim. With the triple aim, we're looking to improve the health of a defined population, enhance the patient care experience, and to reduce or at least control the per capita cost of care.
We're in the midst of a paradigm shift, and educating health professional students is a great opportunity to move toward interprofessional care that meets the triple aim. When you look at the picture, what do you see? It's both a rabbit and a duck. Once you see both perspectives, the paradigm can shift.
So, what is interprofessional in healthcare? It used to be that one provider cared for a patient and had little awareness of the practice outside of their own discipline. Multidisciplinary teams are teams that are a lot like the blind man and the elephant. There's different aspects of patient's care or elephant's care that are handled independently by the appropriate practitioners in different disciplines, and each is responsible for his or her own area of expertise. However, that leads to highly competent individual practitioners, but not always highly competent teams. And interprofessional education is meant to help make your team be more competent as a team. And what interprofessional is the provision of health care by providers from different professions in a coordinated way that helps to provide mutual goals and resources and responsibilities for patient care.
Because interprofessional education has become so important, healthcare professional educators have determined there should be competencies for healthcare professional students to learn. This set of competencies was developed by an interprofessional education collaborative. The competency domain number 1, value and ethics, is what we focused on in our first session. While we will continue looking at values and ethics for interprofessional practice, the focus of today will be competency domain number 3, interprofessional communication.
So how does it work here formally? Applying evidence, we've all worked together to create authentic experiences that allow you to work and learn together while trying to address realistic clinical scenarios. In the upcoming session, we'll also introduce to you some tools that promote communication and teamwork, which will facilitate the skills that are necessary for you and for us to realize integrated healthcare. Specifically, in the upcoming session, we'll be targeting these learning objectives related to interprofessional care delivery. Use effective communication to facilitate collective competence in care delivery. Express your knowledge and opinions with clarity and respect. Demonstrate an ability to construct a person-centered plan of care that incorporates your team members and the other disciplines. And employ an assessment tool to provide feedback about effective communication.
The Situation Background Assessment and Recommendation, or SBAR, was originally developed by the U.S. Navy as a communication approach used on nuclear submarines. SBAR is an effective way to communicate important information. SBAR offers a simple way to help standardize communication and allows parties to have common expectations about what is to be communicated and how the communication is structured. SBAR promotes quality and patient safety. Clinicians use SBAR to share patient information in a clear, complete, concise, and structured way, improving communication efficiency and accuracy. It is recommended by the Joint Commission as a best practice for standardized communication.
S is situation. Briefly describe the situation or problem, such as who is the patient, what is going on, why is a healthcare professional needed. This will alert the person you are speaking to of the urgency of the situation, who or what is needed to address it. Why is this dog in an oven? B is background. This includes all background information that will help to address the situation or problem. Here you collect relevant history, diagnosis, previous procedures, or relevant family background. This usually includes subjective information. A is assessment. This is your assessment or objective information that you have collected. Any data that you specifically have collected, such as vital signs, pain, medications, lab results that you have done, your assessment of cognitive status, language, or speech. R is recommendation. Here, concisely suggest a plan or recommendation based on what you know from the situation, background, or your assessment. What actions are needed, and what is the urgency or timeline here.
Now let's take a look at an SBAR for someone that we all might be familiar with, Harry Potter. Here's an SBAR for Harry that might have been provided by a social worker. The situation is that Harry is a young boy and he's living under the stairs. His family life has become increasingly hostile. The background is that his parents have been killed by Voldemort. He lives with his uncle and his uncle's family, and they see him as a burden. Wizarding urges have been systematically suppressed by his family, leading to Harry's current crisis of identity. Our assessment is that he's alert and oriented. He reports occasional dreamlike states in which he sees his dead parents. The scar on his forehead suggests to us that he has wizarding genes. He's not currently on any medication, but his uncle has requested something to keep him under control. The wizarding gene protocol results suggest a score 200% above norms. Our recommendation is that Harry receive swift transportation via train to Hogwarts School. At Hogwarts, he will have socialization with peer wizards and at the same time be mentored by experienced wizards to restore his well-being.
So just to review, a couple important things. Number one, arrive early so that we can start on time. We have a packed day and we want to help you learn as much as possible. Number two, review the room and group assignments so that you know where to go for both the first and the second groups. And number three, most important, come ready to contribute to the problem solving. We're looking forward to having a great morning.